wherever you're comfortable.
Yeah, take a seat.
So hopefully you're all in the right place. We're here to talk about back pain, causes of back pain, relieving strategies for back pain. I'm Dr. Jessica. I'm a physical therapist here. Just show of hands, has anyone been to Physical Achievement Center before, or are you all here for the first time?
First time.
Perfect. So we'll start with a little bit of introductions and then we'll get right into it. So here at PAC, our mission is to help people achieve greater mobility and strength for their active lifestyles while avoiding unnecessary medications, injections, and surgeries, even when nothing else has worked. Like I said, I'm Dr. Jessica. I am specialty trained in spinal and upper and lower body mobilization, spinal manipulation. I'm currently wrapping up my fellowship this month and kind of specialized in dizziness, balance training, and I'm also certified in dry needling. So, and I've got Dr. Eric. He is the owner, founder of the clinic. He has over 33 years clinical experience. He's fellowship trained and has thousands of successful cases in the area. Like our other PTs, he is also dry needling certified. Dr. Rebecca is our third PT, and she has over 10 years clinical experience, is fellowship trained as well, and has thousands of successful cases in the area. We have one physical therapist assistant, Courtney. She has 6 years experience. She's specialty trained in pain relieving massage and certified as a spine, upper and lower body specialist. Robin is our wellness, nutrition, and neuropathy lead. She has over 25 years of experience in the medical field. And I believe last is Lori, our occupational therapist. She specializes in lymphedema, swelling management and treatment. So again, thousands of successful cases in the area and really an expert in management of swelling. So a little bit about us, we have over 240 Google reviews, so if you're ever looking for true patient testimonials, that's a great place to look to kind of see, and I believe on your clipboards you can find a few of those printed out to hear what people have to say about us. The clinic itself was started to help individuals make better choices about their health care through education, to help people heal naturally. Like I said, avoiding those unnecessary medications, injections, and surgeries. We want to help people who are unsure, stuck, or confused about what to do next for their pain, weakness, numbness, and balance. And make sure they're never disrespected by saying, take these medications, more medications, you just have to deal with it. Ignore your pain, what do you expect at your age? All of these common things we hear in the medical field. So we'll go a little round robin around the room to share two things: your first name, and then what are you having trouble doing because of your back condition? What are you afraid of most with your back condition? So start right in the front here if you don't mind.
So I'm Ann. I've been struggling with lower back pain for a couple of years, and I just want to just get out and do fun things like kayaking and bike riding and doing stuff with my daughter.
It can be limiting if it backs. Alrighty, coming across here.
I'm having a lot of lower back pain and a lot of pain in my leg, and I've been out of work because I have 2 bulge discs in my lumbar.
Okay.
So I've just been like trying to heal and rest.
Find some solutions.
Yeah, I'm supposed to start going back to work soon, and like I'm still having a little bit of leg pain.
Yeah.
And like I don't wanna like have to go back to work and like end up being in pain again.
Right,
Yeah.
right. You want to make sure that you're making a full recovery.
Yes.
I'm Linda. I'm Jim's grandmother. I don't have back pain.
Good for you.
But I have a lot of trouble with my knees.
All right, well, this is a good place for you too. This presentation may not be specific to you, but definitely a consultation.
Sure.
And I'm Teresa, lower back pain, sciatica down the
Okay.
leg, and it is affecting my golf game.
Oh no. Oh, we gotta get you back to bed as the weather warms up. And
My name's Andy, got lower back pain. I mean, the more physical stuff I do, the more it gets aggravated, and then I end up stopping, and recently started to feel something in my lower hip joint in the
Okay.
back, so.
sure, it's all connected.
Yep.
Alrighty, well, we'll get right to it, starting with some common causes of back pain. First with that buzzword, sciatica. I heard it a couple times. So the sciatic nerve, if you're not quite up to date on your anatomy, it's the longest nerve in the body, and it travels down the leg. It starts from the lumbar spine, goes through the back, down the back of the leg, and then it branches into two nerves. And when it's pinched at any spot, usually in the low back, it can cause pain, tingling, weakness, numbness in the leg, sometimes heaviness. So, little pop quiz. What do you think the biggest mistake someone can do?
Not moving.
You got it. You got it. Doing nothing at all is probably the worst thing you can do if you have back pain. Generally, the rule is the longer you've had the pain, the longer it's going to take to get relief. So doing something sooner than later is always the best course of action. Following that, people make mistakes of just masking it with NSAIDs, braces, pain gels, creams, prescription medications, especially muscle relaxants, opioids, that might make it feel better, but they aren't actually fixing the root cause of the problem. Ignoring a more holistic, comprehensive treatment and hoping for that one silver bullet, quick fix, single solution, but meanwhile you're missing out on confidently getting back to your goals. Or relying exclusively on surgery and injections when we know that those shouldn't be our first line of defense for this type of condition. So there's basically three ways that we see people handle their pain. The first is they can ignore it, make excuses. Second is they can alter it, mask it. And third is they can handle it, they can actually do something about it to get it better, right? So we'll talk through what the most common causes of low back pain are. First one being a disc herniation. So if someone has a disc herniation, we'll see often their pain is increased with bending forward, twisting, coughing and sneezing, which increases the abdominal pressure. Generally, that pain is going to be sharp and run down the back of the leg if there's a disc herniation. Theoretically, it's more common in younger individuals because their discs are more hydrated, but it can happen at any age. Generally, if forward bending hurts and backward bending is relieving, that can be a predictor that it's more likely a disc herniation. Standing may be better than sitting. So then we've also got arthritis or spinal stenosis. That's going to be kind of the opposite. You'll get your pain when you're upright, standing, or walking. And that's generally in people age 50 or older. You'll get relief with sitting because we're kind of opening up the space for that nerve. And also have pain from muscle instability. So there may be a painful catch as you're moving through the range of motion, pain with changing positions. When you bend forward, you kind of want to walk yourself back up. And the important thing about some of these conditions like that muscle instability is if you go to your doctor, they order imaging, it's not going to show up. They might see the normal age-related changes and diagnose your pain as arthritis, but it could actually be coming from something else. So it's important to get a proper history and examination to really determine where things are coming from. You can also get nerve pain or irritation. Seems to never go away. You can have very little activity that's causing long-lasting pain. This isn't going to show up on your X-ray, CT, or MRI. I always like to share this because I think a lot of times imaging is misrepresented. We think that it's this black and white, clear picture of your pain, but this study tells me a lot. So the study looked at normal, healthy, pain-free subjects who got MRI and CT images, and it splits it up by age. So you see at the bottom, people in their 20s, a fair amount of them, 25%, have disc degeneration, disc bulges, disc protrusions, and by the time patients get to their 80s, almost 100% of them have disc degeneration, and a fair amount of them, half of them, have spondylolisthesis, facet degeneration, and these are people who come in saying they have no pain at all. So when we see these findings on an image, can we say that that finding is the sole cause of your back pain? Not necessarily, right? All of these people have these things that look pretty scary, sound pretty scary on imaging, but they don't have any pain. So we know that it's possible to have abnormal imaging findings and be pain-free, and similarly to look normal on imaging and have a lot of pain. Pain is really complex and multifactorial. Couple bonus causes of pain, contributors to pain. The hip joint is a big one because the back can kind of refer pain to the hip can kind of refer pain to the back, or because it's stiff, your back has to take on more of the strain. So the two are really interrelated, and we've got to really have a proper examination to find out how they work together if the hip is contributing to your back pain. We've also got this really interesting phenomenon that happens from the TL junction, so where your thoracic spine meets your lumbar spine in the middle lower back here, and that's called Main's syndrome. It's not going to show up on imaging, but if you see that pattern of the nerves there, you can get pain in that distribution that's actually coming from this area. You may not have pain at this area at all, but it kind of feels like hip or back pain. So we need a proper history and examination to rule that in or out. We've got piriformis syndrome. The piriformis is a muscle deep in the hip, and that muscle, if it's tight, you see that it passes right next to the sciatic nerve. In some individuals it's on top, some it's underneath, and some that sciatic nerve passes straight through the piriformis muscle. So that muscle, when it's tight, can compress and pinch on that nerve, causing sciatica symptoms that are actually coming from the muscle and not from the back itself. So symptoms may be pain in the buttock region. It can radiate down the back of the leg. You may have numbness or tingling in the leg, weakness in the leg. So back to our pop quiz. Do we think it's possible to have more than one issue going on?
Yes, definitely.
Almost always, especially the longer you've had pain, the more these interrelated areas start to compensate, and then we start to see multiple problem areas. So that brings us to probably everyone's favorite part of the presentation, is we get to choose a volunteer to do a little demonstration of a quick assessment and mini treatment to kind of show what things look like. So, any volunteers?
I will. Oh, no, you can.
That hand shot right
Don't
up.
matter.
You can go, you can go.
So, stand on up. What I'd like to start with is just seeing the way that you move. Now, you said you have some,
So it's lower back pain, and now I feel something like and this area, the
Okay.
lower back.
Does any of it go down the leg any further than that, or is it just kind of starting
No,
to creep
but
into
like
the
sitting in that chair, which is like very uncomfortable. You just feel it on both
Unfortunately.
sides.
Yeah,
Um,
just like across the back and into the hip.
yeah, it's like right at the top of the buttocks,
Yeah.
right across.
What
But the
generally,
muscles, these muscles I can feel are like really tense.
yeah, what generally makes it better or worse is being
Doing
standing. I was gonna ask, are standing and walking something that you would do to relieve, or would you say?
Usually when I
that's
aggravate it,
sometimes-
I just go and sit in the most comfortable chair at home.
Okay,
You
sitting
know.
takes it off.
Yep.
Being on your feet too active brings it on.
Yeah, cause then it just, I don't know, it just,
Yeah. Well, let's take a little bit of a look. I will actually, if this hallway's free, I'm gonna just take a look at the way you walk. That can give me some insight into the way you're moving. This will be just really quick, so if you can't see, that's just fine. I'm gonna have you just walk down to the end as you normally would. Try not to change anything for me, and I'll just kind of talk out loud so everyone else can see what I'm seeing, but you get very little rotation through your trunk. You're pretty rigid as you're walking. And that can be a compensation as a result of the pain. It also can be a contributor to the pain. So you look at all of these findings as a possible cause and a possible compensation. So what I'm gonna have you do is move through some range of motion. First, reaching forward, kind of bending, and let me know what you feel there. Tightness in the back,
Tightness
back of the
here.
legs,
tightness here.
and come back up. If I asked you to put your hands on your hips and bend backward for me, what does that feel like?
So I can feel like a pain like right at the
Increases
bottom.
your pain.
It don't really increase the pain, but now I notice a pain like at the bottom of my spine.
Sure. More from bending backward
Yep.
than going
You know, and then
forward.
there's still a slight pain here.
Yeah, so you seem to have that preference where flexing feels good, extending or being upright doesn't feel so good.
Mhm.
I'm gonna have you bend to the side. Good. Does that change anything?
No.
To the other side. A little stiffer there.
Mm-hmm.
Does that change anything? It's just stretching.
Just stretching.
So I think what we'll do here, I do like to get a little bit of a look at the hips, especially because that seems to be a contributor. Sophie, would it be possible to get this
Out
just
more?
like a couple inches away from the wall?
Yeah, absolutely.
Alright, and I'm gonna grab a pillow. That's just fine.
Do you want the other side out a little further?
I think it'll be just fine.
Perfect.
So we'll have you laying on your back. And from your back here, I'm gonna check out how your hips move. Just try to relax and allow me to move you. I'm stronger than I look.
Mm-hmm.
Let me know if anything changes your pain or if it feels like a big stretch.
So like right there, you know, everything down there kind of
Starts
Relieve.
to relieves things to flex,
Mhm.
which is consistent with how you were moving and standing too. How does that feel?
kind of relieving. But then you feel everything down in your leg muscles.
In the knee?
Not in the knee, just basically,
Stretching.
Yep.
Yeah. Painful stretching or just kinda hasn't moved that way in a while?
hasn't moved that way in a while.
Good mobility here, but your flexion and your external rotation are pretty tight.
Mm-hmm.
So that would be an early on course of treatment. Do you notice in your hips, you may have said this, is it more on one side than the other?
Lately, it's been the left.
Okay. Let's take a look at this. Does that change anything for you? This side
No.
seems looser.
Yeah.
Relieving, aggravating, or just stretching?
Relieving, you know, down to the lower part again and
Yeah,
more
just a good
stretches.
stretch. Feels tight too, but not quite as tight as the other side.
Mhm.
Still just good stretching here.
Yep.
And just good stretching there. So, I think a really great place to start for someone like you is with a long axis distraction, which is a form of joint mobilization that kind of works on the hip, but also secondarily helps with the back. Also can affect the knee a little bit, but primarily we're targeting the hip and the low back
Mhm.
with that. And let me see if I can get my hands on a towel. I think we have some right in here. Right in here. I got it.
Large one?
Just, yeah, the like face towel.
Yep.
Alright. So lots of different approaches I would take with someone like you, and for the sake of the 5-minute miracle, we'll focus just on the hips, but treatments, yeah, just the size is good.
Right.
Thank you. So, okay. So what I'd like to do is slip this under this knee. So what does your pain stop you the most from doing?
Keep going. You know, like this weekend I was doing stuff and then it, you know, it just gets to a point where it's like, I
You
just
just
better
need a
stop,
break.
I just better
Yeah.
stop and,
Mind if I slip this off?
yep, that's fine.
Mostly those upright physical activities, so. And how long have you been dealing with this?
Well,
few years.
Quite some time, yeah.
Yeah. Was there ever an injury to the back, or it just kind of came on gradually?
No, I just think in my younger years, I always overdid it and now that I'm getting older and stuff like that, I'm trying to start to think a
Catching
little
up to
smarter.
So, I want this to feel comfortable everywhere, including my contact at your ankle, your knee, your hip, your back. What I'm gonna start with is just that kind of gentle pull. You can gradually progress a little firmer. And what I'll do is kind of play around with a couple different angles. This is that long axis. What are you feeling there? Just kind of gentle stretch.
Yeah, I mean, it feels like relief.
Good, good. That's what I would expect and hope for. So,
So it's kind of like what they used to call traction in the hospital.
so it's a form of tractioning. And with this, we can be a little bit more specific, but I think it's a great place to start, right? So, we like to look at a really comprehensive approach to all of this. And the first thing we want to do is calm things down. We want to get them feeling better, we want to get them moving better, and then we want to progress to build them back up so that they're strong. But yeah, some sort of traction is often a really good place to start with back pain like yours, because it just kind of, it offloads the spine a little bit. It stretches that hip joint capsule. We know things are tight. It gets things moving a little better, and it stimulates all these neurophysiological effects that are probably more sciencey than most of you care to know today, but it triggers a lot of processes in your body that promote healing and make things feel better. And that's the goal of a lot of our manual interventions, is get things calmed down and feeling better so that you can do the things you want to do. How's that feeling with time? Still Good intensity, not too much.
Mhm.
And then my line of pull can determine how much we're affecting your back or your hip. So when I'm here, probably a bit more into your back. As I come out this way, may affect the hip a little bit more. Yeah?
Yep.
So it's very,
That exercise is good for the sciatic nerve too.
it's great for the sciatic nerve, yeah. So there's a lot of different joint mobilizations that we can do, and it's all individual. It depends on what your problem is, how your body responds to it. There's not a one-size-fits-all cookie-cutter exercise that everyone with back pain should do. If there were, either I'd be a millionaire or I'd be out of a job. Let's get you sitting up. So I want you to notice, and we did just do that one side. In a longer treatment, we'd probably treat both,
Mhm.
but I know that was your more involved side. I'd like to see how you feel, just kind of moving through that hip. Maybe we try out,
I mean, it feels better just with that.
just with that
that
5
little-
minutes
that
of
little
pulling.
5 minutes.
Right, so imagine
It's a miracle.
we do. It's a miracle, look at that. Thank you for volunteering,
Yep.
and you can have a seat. So, that was just a very brief assessment and very quick introductory treatment. Now imagine we go in depth to his entire medical history, looking at all of the contributors that are possible with this pain, thorough evaluation, and 45 minutes of one-on-one time, more detailed treatment. You can imagine that little bit better that happens in 5 minutes adds up to a lot better over the course of a plan of care that's customized to you. That's the hope, right? So, physical therapy is I would argue, should be the first line of defense for most types of back pain. But we like to talk about, well, what are the other options? And maybe some of you have tried some of these other options. First thing people think of is pharmaceuticals. What type of medication can I take? But unfortunately, a lot of them have side effects and risks, including drowsiness, dizziness, fatigue, bleeding, bruising, addiction or dependence, seizures, constipation, decreased sex drive, nausea, vomiting. Research shows hydrocodone causes 62% of accidental acute liver failure. These medications are causing more deaths than motor vehicle accidents. Welcome in. So, then we've got NSAIDs. So those are your primarily over-the-counter anti-inflammatory medications. And those have an increased risk of heart attack, blood clots, and stroke. So, I mean, to me that doesn't sound like the first line of defense. That's a lot of risks for just a little pain relief. They can cause inflammation, bleeding, ulceration, perforations of the stomach. So, what other options are there? There's got to be something better. The medical field has to have something better than these medications for us. What about injections? What are the side effects and risks of injections? It can increase the risk of osteoporosis, of cataracts, elevated blood sugar, immune suppression, permanent joint breakdown. The effects get less effective the more you use it, and the relief is generally very temporary. And you're only allowed to get them 3 times a year because of all these side effects. Research shows that there's statistically insignificant improvements in life pain with injections. And it's promoting deterioration of the skeletal quality. It increases the likelihood of fractures by 21%. That's not a small number. and it doesn't effectively reduce the rate of subsequent surgery. And we've got lumbar surgeries, and again, some people get no relief at all or their symptoms are made worse. There's this resultant scar tissue that can cause its own set of problems. It's a very painful recovery period, risks of infection, very costly, and can cause limited mobility as a result. You may still need those medications that you got the surgery to try to avoid. 72% of people who get a lumbar surgery need another lumbar surgery. I don't like those odds. Research shows that 53% of L5 to S1 surgeries fail to produce relief, and up to 70% still have pain after surgery. 1 out of 4 people are dissatisfied with those surgeries at 2 years later, and only 26% of people actually were able to return to work as a result of that surgery. Then we've got a more conservative option. We've got spinal decompression, and that has no side effects. A small number of people might have mild temporary soreness, but all of those risky side effects that come with medications, injections, and surgeries are not a problem with spinal decompression. Research shows 71 to 89% success rates for non-surgical disc restoration via spinal decompression. It reduces herniations significantly in up to 71% of people. It increases the disc height, and people are having not only short-term but also long-term effects with up to 9 out of 10 patient satisfaction for patients that this treatment is indicated for. So when is it time to get a consultation for your back pain with a doctor of physical therapy? First of all, if pain is interfering with your ability to sleep through the night, if it's keeping you from doing your daily activities, your hobbies, your recreational activities at the same level that you used to do them, if you're fearful of it affecting your independence and you want to stop worrying, you want your family to stop worrying about you, if you keep masking all of the symptoms with ointments and not actually getting better, you're just masking your pain. If you're interested in minimizing all of those more risky interventions and want to eventually learn to self-manage without lifelong reliance. So physical therapists, modern evidence-based physical therapists will provide pain relief through joint mobilization and manipulation, provide massage work for pain relief and mobility, develop custom exercise prescriptions based on your individual needs. Like I said, there's not one cookie cutter program for everyone with back pain. It needs to be customized to your specific problem and your level of tolerance. And develop a strengthening program to increase stability and help you get back to your active life. Provide pain relief through dry needling if you're interested. Dry needling is a great option for low back pain. We can talk more about that one-on-one if you're interested. And ultimately, a modern evidence-based doctor of physical therapy should be the provider of choice for non-surgical and non-drug prescription care to get you the best tools to get to your goals. We kind of start out where you're in a lot of pain. We need to relieve that pain and inflammation. We need to correct the root cause of the issue. Then we need to build strength, and ultimately by the end of the plan of care, our goal is to get every patient into the blue at the top of there with lasting relief and an ongoing self-management strategy to prevent worsening and recurrence of their symptoms. Like I said, those patient testimonials are available on your clipboard, so you can read those at your leisure. But our promise to all of our patients is one-on-one individualized treatment, including individualized home exercise programs, no medications, injections, and surgeries. We'll include supplement or lifestyle recommendation if it applies to you. where do we go from here? Everyone who is here today gets the opportunity for a a 30-minute discovery visit to find out the cause and solution to your mobility and pain issues. That includes a complete history of your symptoms, assessing the spine, assessing your hips, your walking, your muscle strength, and ending with a doctor's report of findings, kind of explaining what's going on and what treatment options you have and what that would look like for you. So how much does an assessment like this cost at a medical center? Probably quite a bit. But for everyone here today, it is going to be offered for only $47. If anyone has Medicare, that cost may be slightly different just based on their restrictions at their usual co-pays. But the value is $260, but we're offering it for $47 for everyone here today. And we've got options for signups. Are there pre-planned times, or are we going over there for scheduling?
We have pre-planned times, I just have it in the back.
Perfect. So on your clipboards, you'll find a new patient form if you haven't seen that already. That gives you the opportunity to share your information with us. If you have your insurance cards along, bring those as well, and then you'll get to head on over to the front desk to schedule.